Yeah, so we've touched on it, what some folks might say are some of the key drivers when we think about maternal health outcomes in the US. And in the intro video, we talked about how the US has one of the highest maternal mortality rates of high income nations. But the flip side of that are the near misses, the maternal morbidity, which we don't quite talk about nearly as much. And so I guess I'm also interested outside of trust issues or this kind of concept of respectful or disrespectful care. What do you think are some of the other key drivers in our nation's maternal morbidity crisis?
So it's interesting on the morbidity side, 'cause, right? I would say like maternal death is like the canary in the coal mine, because for every like one that is like the worst outcome that you could ever imagine, there's at least 100 of the severe sort of morbidity events, and then a ton of folks honestly just have a pretty terrible experience. And I don't want to even like discount that last group, because I think everyone should have a great experience. People shouldn't walk away from birth with birth trauma. And honestly, if we just focus on maternal mortality, we sort of miss that broader picture, uh, that generally women are having a really poor experience. I think only maybe a quarter of women say they have very good or excellent care. So we're failing at every level. I still think even in the sort of severe morbidity space, though, we're still talking about a lot of the same issues. And I'll talk about mortality, but it still is true for morbidity, which is I think there's this feeling like, okay, if you had a maternal death, it must have happened at the hospital, right? Like during labor and delivery. And that's about 1 in 5 deaths. So about a third of them actually happen prenatally, and nearly half happen postpartum. And we have a really poor infrastructure to support women and birthing people during that time, right? I think most of our focus has been on how do we improve safety on labor and delivery, and that's obviously a key piece of it. But if we send women home and we don't check on them again until the 6 week visit, how do we think we're meaningfully going to change outcomes in that space where you have huge risk for bleeding, for hypertension issues, for cardiac issues, for all of these things that are actually driving a lot of the severe morbidity we see? And we don't have that connection point and that continuity. And some of it's driven by a payment system that doesn't recognize the importance of support. Part of it's driven by, honestly, us still having a really antiquated healthcare system, right? We do the vast majority of prenatal care appointments in this country in person and haven't leveraged technology as a meaningful way to connect with patients in between visits to get more information about how they're doing, both physically and mentally, and incorporate that into it. And so I think a lot of what we focus on ULA is absolutely you should have a great birth experience, but we should be focusing as much time and energy and attention on prenatal and postpartum care, because that's where we're really failing women and where it's showing up in mortality and morbidity and honestly poor experience at large.